you are in a warm weather now, huh?
Yeah, actually, I'm logged in a hotel, in a very nice hotel in Kuwait for 1 week quarantine. It's a very nice view on the Gulf, so it is. I cannot complain. However, being trapped somewhere is not nice, even if it
Yes.
is, even if it is in the heaven.
Yes, yes, yes. So then, is it 1 week quarantine over there?
Yeah, it's 1 week. Actually, it's 2 weeks, but for the physicians, it's 1 week only.
Oh, nice. So
Yeah.
physicians cannot spread on the week too, huh? So
Yeah,
virus
they are needed.
recognize that, huh?
They are needed. They are required to be in the field.
Very good, very good,
Yeah.
amazing. Okay, thank you so much for being with us again. It's an honor, like always.
Thank you.
So yes, the topic that is about the treatment of snoring with Fotona.
Yeah.
As I'm just going to say quick history of this because I have sleep apnea and
Yeah.
then snoring, and my wife
Mhm.
always complains. So
Oh.
I asked Dr. Badawi about a year ago to do the treatment with me for Fotona. And I did one session treatment. He recommended I have to come three times, but I was
Yeah.
lazy. I didn't do it. So I did the first time. Even right after that, my wife was just saying, you know what? It was amazing. It's just totally changed her life,
Excellent.
not
Excellent.
my life. I don't know. Anyways, like so it was very interesting. But I think after 3 or 4 weeks, it went back to the origin. I'm using CPAP right now,
Yeah.
but I didn't go back because Dr. Badawi told me you have to come at least three, I don't know, 3 or 4 sessions you
Three
mentioned,
sessions. Correct.
which makes sense because that you need to just, kind of maintain
Yeah.
the treatment.
Yeah.
But I didn't do that. Maybe when you're back to Toronto, we do it again.
Yeah.
So, but
Hopefully.
I got the result.
Excellent. Actually, the corona came and everyone stayed at home, and this was one of the reasons why we didn't continue. But
That's
hopefully, when
true.
I come back, we'll be able to do it in a row because it really makes a big change. And the amazing thing about it, as I'm going to be explaining in the lecture, that we are able to get almost immediate result with no pain, with no downtime. You have tried it yourself. Uh, just mild heating. It might be a little bit more sensitive in one area rather than another area, but there is no downtime. And this was something magical. It was a dream 10 or 15 years ago to have a procedure which is effective, safe, associated with no pain and no side effects. This was a dream. Today, with the development of the laser technology and techniques and good machines in our hands, we are really able to achieve outstanding results in the different aspects as we are going to discuss today.
Beautiful. So I love COVID from the sense that we can blame COVID for everything. It wasn't COVID. It was my laziness. I didn't come to you, to be honest. But after you were not in Canada. But anyways,
Yeah, yeah,
so okay then. So I just need to mention that this event is sponsored by Clarion, our great sponsor. They are always very helpful, and then they always, just provide a lot of good services in the industry. A lot of clients or patients, I'm saying that practitioners are very happy with their services, and we are honored to work with them. So, and then yeah, I'm just gonna leave Dr. Badawi, and then you can continue with this amazing presentation. At the end, I will come back with the questions, and then we go from there.
perfect. Perfect. Thank you very much. I really appreciated the
Thank you so much,
introduction.
Doctor. Thank you, Dr. Badawi.
And also, I would like to thank Clarion for sponsoring this event and those 2 days. Yesterday, we spoke about the 4D rejuvenation and the concept of 4D. And today, we are continuing by some other new applications of the SP Dynamis laser from Fotona, which is having both Nd:YAG and ErbMYAG lasers. Very unique Nd:YAG and very unique ErbMYAG. Both the components of that laser are really totally different from any other laser system containing Nd:YAG or containing ErbMYAG. And that's why wherever I work, I insist to have that laser, whether it's Canada, Kuwait, Qatar, Egypt, Saudi, Hungary, wherever I'm using lasers, I do insist to have the SP Dynamis as one of the most efficient and most safe lasers to work with. We have two topics today to cover. the laser treatment of snoring, which is very interesting. And then we are going to talk about the hair restoration with the laser, which is something I did not believe initially that's going to work. However, the reports we are seeing from all over the world are confirming the effectiveness and the safety of that treatment. So we'll start with the snoring, which is, again, something we didn't expect that we are going to go that far using the lasers, where we are able to aim a laser beam towards a tissue, and then no damage happens. However, the desired improvement is being achieved with no pain, with no side effects, with no downtime. This was, as I was just mentioning a few minutes ago, it was a dream, which is really becoming true now. So what is the issue of the snoring? Before we go to the snoring, I just want to remind you with the fact that with the ERBMYAG laser, if we are using a short pulse ERBMYAG with high fluence, we achieve ablation. However, with the same wavelength, if we are using subablative fluence with long pulse, we get some sort of coagulation. Let us not use coagulation because this is not what we aim at, but just heat. And this heat is going to make some changes in the tissue. Yesterday, I did operate a video, but it caused some issues. And with this video, we were able to demonstrate that if you are using short pulse of erbium on the tissue, it is just ablation. The tissue does not shrink. However, when we are using longer pulse, the tissue and the skin shrinks because of the heat deposit under the surface of the skin. This is making just like when we have a wool plover or something, and if we put it in warm water, it is going to shrink. So whenever we have something wool, it has to be dry cleaned or cleaned with not warm water, with cold water. Otherwise, it's going to shrink. The same thing happens to our tissues. If we aim the laser with certain heat subsurface, it's going to shrink. Of course, this temperature should be calculated. It should be around the 40, 45 degrees. Otherwise, we are going to cause damage in the tissue. Now, regarding the night laser or the snoring treatment with the Fotona laser, this is what the company calls that kind of treatment, night laser. We are using the non-ablative ERBMYAG and aim it towards the uvula, the soft palate, and the surrounding tissue. So there are 8 spots which we would like to treat: the anterior nostril, the anterior pillars, sorry, and then we would like to treat the hard palate and the soft palate. Then we would like to treat the anterior pillar of the opposite side, and then the hard palate and the soft palate of the other side. And then we would like to treat the posterior pillars, the posterior pillars of the other side, the uvula, and then we need to treat the base of the tongue on both sides. So those are the areas which we are targeting to treat the snoring. Just to let you know, the parameters we are using for this kind of treatment are the same parameters which we are using for the intraoral tightening to improve the nasolabial lines and the marionette line. This is what we do on the buccal cavity in different area in order to achieve tightening in the tissue. Simply, when we are doing these techniques, we are leading to tissue shrinkage, and then as a secondary effect, we are going to get collagen stimulation, and the tissue is going to be firmer. Instead of being loose and lax, we are increasing the firmness of the tissue, and this is definitely improving the tone and improving the upper airway. And when we are doing that, the upper airway is going to be open, and this will improve the oxygenation during the sleep. And that's why patients who are subjected to this kind of treatment are reporting that they wake up much fresh than before. So this is something which is having an immediate impact, and patients are appreciating very much this kind of treatment, which is associated with no pain, no side effects, no downtime. So a major advantage of that technique is that no anesthesia is required. We don't use any needles. no pre or post-operative pain. We are conducting 3 sessions over 2 months, and each session is about 15 minutes. So it's really very quick, not a big deal. And we get immediate result from the first day, an average of 50% reduction in the snoring. This is the technique which we do. Now, Fotona has developed the handpieces, and there is another handpiece which is like a glass tube, and it has a mirror which is able to reflect the laser beam 90 degrees towards the tissue. So it's much easier, much more convenient. When I started the procedure, I started it with the PS03 and the R11, and it was okay for me. Definitely with the developments, there might be tools which are making our life easier. However, I was using the handpiece, the R11 or the PS03 handpiece. So we direct the laser beam towards the tissues, which I showed in the first photo. It is really very important to have some sort of objective assessment as well. So in order to get some objective assessment of the tissue shrinkage, patient's oral cavity is evaluated and photographed before and after the procedure. Also, patients are classified according to the Malampati classification. And this is really a very important starting point because we cannot jump steps. So it's very important to know which class the patients are at, because according to the initial class we are starting with, we can tell them what to expect, and we are going to show them the progress. So what is this Malampati classification? It is a classification which is classifying the upper airway obstruction into class 1, where we have fully visible tonsils, uvula, and soft palate. Class 2, where we have visibility of hard and soft palate, as we can see, the hard and soft palate, and upper portion of the tonsils and the uvula. This is class 2. Then we have class 3, where the soft and hard palate and the base of the uvula are visible. And then class 4, we have only the hard palate visible, like this. So I'm going to show you some real examples and real photos. But the important thing here is that the improvement is going to be according to the classes. So if someone is in class 4, whatever we do in the best hands, we are not going to jump and go down to class 1. It is going to move from class 4 down to class 3, or class 3 down to class 2, class 2 down to class 1. So these are the expectations, and this has to be communicated with the patient. So this is a patient with class 2, where we can see that the hard palate, the soft palate, and part of the uvula and the tonsils are seen. So this is the class 2. Then this is class 3, where we can see only part of the uvula and the hard palate and the soft palate. The bottom of the uvula, it cannot be seen. So this is class 3. And now this is class 4, where we can see only the hard palate and part of the soft palate. We cannot see even the base of the uvula. So those are the classes which are really very important to in the evaluation process for the proper expectations of that procedure. The preliminary results were showing that evaluation of the results were made with subjective assessment of the patients answering the questions from a questionnaire. So there is a questionnaire they need to answer. And then patients evaluated average snoring reduction after the first session between 30 to 60%. So the average was about 45%. And after the second session, between 50 to 90%, with an average of 65%. All expressed being very satisfied with the treatment and the results. This was the preliminary results of the initial protocols using the night-lays. Also, there was a polygraph evaluation of the night-lays efficacy, the first test. Average reduction of snoring index was 52%, and the apnea index also significantly improved, which was about 48%. To my surprise, those results are very much comparable with the surgery, with all the hassle we are going to get through in order to go through surgery, with the pain, with the preparation, the post-operative pain and sometimes bleeding, potential infection. When we are able to get a technique which is enabling us to achieve this kind of results with no pain, with no preparation, with no post-operative procedure, with no complications, I think this is outstanding. The secondary findings of the procedure were that patients who were suffering periodical and recurrent throat infections claimed that it disappeared. And the rationale of that is that the heat is disinfecting the area, plus it is shrinking the crypts. When the tissue is shrinking, then those crypts, which are a very good medium and shelter for the bacteria, the microorganism, are going to be blocked, and this will eliminate those clones of bacteria in those dead spaces. So this can be considered as a possible treatment for pocket formation or crypts in tonsils that shelter bacteria and generate bad breath. This is something which is, again, outstanding when we are able to achieve this kind of result safely and effectively, with no pain, with no anesthesia required, with no general anesthesia, with no bleeding, with no infection potential. I think this is something which is great. Now, this is the screen of the SP Dynamis, where we can select the Erbium-YAG with the different application. We can select the Nd:YAG or the combination treatment with a twin light. When we talk about snoring, then it is the snoring which we are going to be focusing on. Those are the parameters which we are using, where the R11 handpiece, the initial protocol of Fotona was PS03, but I discussed with them that when we have a problem like this, we need to treat the whole surface. So R11 is more appropriate than PS03. So the 7mm spot is used, 2.5 up to 3.5 joule per centimeter square. Sometimes we can go a little bit more, 3.75. With a smooth mode, of course, 1.6 hertz. And then we do 4 to 6 smooth mode shots. If this is too painful, then we can drop down to 3 shots. And we do 3 sessions every 21. So every 3 weeks, we are going to be conducting a session. So as we can see, the treatment is covering all the areas I discussed before. And the patient is feeling some heat. The heat is very much tolerable. We don't need to apply any kind of anesthesia, and it takes maximum 15 minutes to cover all the areas we need to cover. One of the nice applications which we are able to do is a phone application, which is measuring the snoring. So what I would recommend is to download those applications. There are several of those applications. You can download on your Android or iPhone. And then you have a record of the snoring before the treatment. And then after the treatment, you are going to still use the application in order to record the amount or the snoring quality and quantity and duration and so on. And then you are going to see the improvement. This is a case where we can see the photograph before and after. And here, this is before the treatment, and then after the initial session, and then later on. So it seems that it is really working. It is really working very effectively. And I was happy to hear the testimonial of Dr. Mohsen, who had only 1 session, after which he was happy, his wife was happy of him snoring less, but then he didn't continue and things came back. The protocol is 3 sessions, 3 weeks apart, and then I would recommend to have maintenance, maybe 3 times per year, every 4 months, in order to maintain the tissue in good shape. So this is the lecture about the snoring. Very simple technique. No complications reported. It has a lot of value, a lot of good things out of it without any downtime. And this is, I think, a really very good step forward in the medicine. I think most of the people attending today are dermatologists. So you are not going to be offering this kind of treatment unless you are in a family practice or you are offering many things. However, people, when they know that you are able to do that, I don't think anyone coming for rejuvenation or intraoral tightening or 4D or whatever is not having part of this problem, and knowing that your device can do that. This is an extra service you can provide very easily and very simply without any hazards, without any complications. So if there are any questions, please go ahead, and I would be very happy to answer any questions you might have. And then after that, we are going to move to the second part of today's program, which is the hair restoration with the Fotona laser.
Thank you so much, Dr. Badawi. That's amazing. It was very, very interesting. So I have a couple of questions here. Is there a contraindication, Dr. Pulio is asking?
I'm not aware of any contraindications. However, if the patient is taking aspirin, then we have to know that there might be some bruises. We have to test a little bit the tissue to see what's going on. It's not, even if that happened, the bruises is not going to be something major. We are using very mild energy. The energy we are using is not causing ablation or surface ulceration or anything. It is just heat deposit under the surface. So the maximum is to see some sort of petechiae or bruises, and it is very rare to happen even when the patients are on anticoagulants. Other than that, there are no any concerns. Of course, if there is any infection, we cannot do the treatment. So if there is an active infection, the tonsils are swollen and there is anything, we wouldn't do that during an acute infection. It has to be treated first.
Mm-hmm. So I think you kind of explained the complications, but is there any other complication you didn't mention that he is asking again?
No complications unless we did a bad job. So if someone
I didn't have any complications, so
yeah,
I was totally fine.
Yeah. Actually, it is frightening to feel that you are going to be treated with laser inside the oral cavity. It is a concept which is not very palatable, and many people are thinking, oh, this is going to be great, no need to do it, and so on. However, it's a very simple technique, and you have seen that. Now, back to the technique. It has to be done with an experienced, trained physician, because if it is done wrongly, of course, if we stack too much pulses in the same spot, we can cause an ulcer. So you can drive a car and do good things with it, and you can drive a car and kill someone with it, or kill yourself. So the same with lasers. If it is used properly, then it is safe, no issues at all. Now, in the era of the corona, it is really very important to make sure that the patient is safe. The patient is not potentially having any infection, because this is a way to transmit the infection, of course, the operator and the patient. So we have to take an extra precaution, maybe some mouthwash to make sure that we kill any virus in the oral cavity is important. We have to take all the precautions, actually, regardless, with the corona or without the corona. Those precautions are going to be taken anyway.
Perfect, perfect. I see, I'm assuming Dr. Allah is asking, what about allergic patients, especially when they use a steroid? Does it affect the results of procedure, or should they didn't take such a procedure?
Actually, if someone is taking corticosteroids, we know that steroids are anti-inflammatory. It can affect the collagen synthesis, which is occurring due to the fibroblast deposition in the area, which are acute inflammatory cells. So it might affect the outcome when it comes to the collagen stimulation. It's not going to affect the outcome when it comes to the tissue shrinkage and the tightening of the tissue. However, the collagen stimulation might be diminished during the cortisone therapy. So I would prefer to postpone the treatment till the patient is off the corticosteroid, to ensure that you are able to get significant collagen stimulation and the optimum result in such case.
So not for any complication, for better result, you
Yes,
recommend that, correct?
definitely. Yeah, there is no fear of complication from that technique.
I have more questions. I have actually a lot of questions now, but I
Yeah.
will come up. But the one question myself I have, I just missed a small part of your presentation. Maybe you mentioned during that part. Is there any difference in terms of being a central or obstructive type of sleep apnea when you want to do the treatment of this, or no? It has a good effect on all of them.
Actually, it's going to improve the upper airway anyway, right? So if it is central, then there is other modes to improve the situation. However, having the night lays and improving the upper airway and improving the oxygen going in the body is going to improve the situation. So I would do it anyway. However, if it is a simple snoring due to the upper airway obstruction, it's going to be the only thing we do. If it is central, then there is other measures which we have to do parallel to what we are doing to improve the tissue in the upper airway.
Okay. Dr. Ala again asking, should patients with snoring be sure that they didn't have any nasal septum deviations or any sinus inflammation or irritations?
Once again, we are physicians, and this is a tool in our hands. This tool is going to improve the upper airway. It's going to shrink the tissue and make the upper airway area much better, allowing more oxygen. If there is any concurrent pathology, whether it's inflammation, whether it's septum deviation, whatever, this is a separate issue which we need to deal with. So we have to understand that when we are using the laser for treatment of snoring, this is just dealing with the tissue I presented, the tissue in the upper airway, in order to improve the pathway for the oxygen in and out. Any other associated pathology has to be dealt with at the same time. It is just like when we are doing hair removal. If a patient is having polycystic ovary or having hormonal disturbances, we are using laser, it's going to get rid of the hair in the skin, but it's going to come back if there are hormonal issues. So the treatment has to be parallel. We are not going to have a magical stick in order to get rid of all the problems anywhere it is in the body. No, it is just a local treatment for the upper airway. Any associated pathology has to be dealt with parallel.
Makes sense totally. And going back to your steroid use of clients, she's asking if for what time before or after the treatment you recommend them to be off the steroid.
Again, I always encourage everyone to think as a dermatologist and as a physician. In the old days, the physician was called in some countries the wise man. And it is really very important to have wisdom for a physician. So if the patient is taking short course of steroid, once they stop it, it is gone. If the patient is taking few months of steroids, it's going to take its way till we are getting rid of it. So Dr. Ala, you are going to be the one who is able to judge if immediately after stopping the steroid, this is going to be appropriate, or you have to wait for 2 weeks or 1 month or whatever, depending on the duration of the steroid treatment and how long it's going to be withdrawn from the body and how long it takes for the steroid to be, replaced by endogenous steroids and adrenosteroids. We know that if the patient is taking it for a long time, we cannot just stop it abruptly. It has to be stopped gradually. So all those are factors. I cannot answer your question because I don't know how long the patient was taking the steroid for.
It's a very individual type of situation.
Definitely.
I think Nina is asking mal empathy done without phonation, right? If I understand it correctly.
Yes, without phonation. Yeah.
Okay.
The patient should be standing in upright position, standing, and that's it, without any phonation. Yes.
Okay. So, and then also she's asking, most my patients doing great, except one patient said after the third treatment, snoring increased. Interestingly, after first and second treatment, he said he was much better. So if I'm understanding, after the third one is kind of just reversing the result.
Yeah, I cannot explain that. However, we are always, for patients who are having snoring, we advise them to try to lose weight. So maybe in the initial 2 sessions, the patient is going on whatever diet or exercise or whatever, and once they started to feel that everything is okay, then they stopped what they were doing. I don't know, but sometimes it happens that once they feel that things are going well, they stop the diet, they stop exercise, and things are going to come back. So there is no scientific explanation for that, because tissue are supposed to improve. If there is any local cause of irritation, infection, inflammation, or they started to gain weight again, then of course the problem will come back.
Okay, perfect. I don't see any other questions. I think that was amazing. And all the questions are answered. So the next presentation, would you like to start right away? I can, let me stop sharing and then you can share your,
okay,
which is about